Welcome to the fourth trimester. The daily Malish, the massage and bath, is intended to be a beautiful bonding moment between parent and child. But in our ER and neonatal clinics, we consistently see the fallout of outdated techniques. When parents use abrasive herbal pastes or aggressive stretching, that well-intentioned routine becomes a primary cause of severe eczema, rapid hypothermia, and silent joint injuries. Before we even discuss technique, there is a strict prerequisite. You must completely delay the absolute first bath by at least 24 to 72 hours so the baby can absorb their natural antimicrobial covering. And the umbilical cord must be completely fallen off and healed. Once those conditions are met, we can replace the anxiety of scrub downs and bone shaping with a safe 15-minute routine. We are going to safely stimulate their neurological development while rigorously protecting their kavacham, their natural skin armor. Newborn skin is structurally incomplete and up to 30% thinner than an adult's. Adult skin is a solid brick wall. Newborn skin is a loosely woven silk mesh where hydration evaporates rapidly. Its defense is the acid mantle, a pH 5.5 shield repelling bacteria. Alkaline soaps and herbal pastes instantly strip this mantle, leaving the delicate mesh exposed. Our medical objective for bath time is to gently clean the skin while actively reinforcing this fragile barrier against microscopic infections. Step 1 is the pre-bath prep. Because their skin is so thin, you must strictly control the room environment before the baby is ever undressed. Switch off the fans and AC and close the windows to block any drafts. Lay out the towel, a clean diaper, and their fresh clothes systematically in advance. Step 2 is the massage. You must use oils high in linoleic acid, specifically virgin cold-pressed coconut oil or sunflower seed oil. If your family has a strong history of eczema, skip plant oils entirely and use plain petroleum jelly. Notice the bold red X next to mustard, sesame, and olive oils. There is a stubborn myth that those specific oils generate internal heat and strengthen bones. The reality is that they are extremely high in oleic acid. Under a clinical microscope, oleic acid actively dissolves the newborn's lipid skin barrier, causing severe redness and triggering atopic dermatitis. The heat you feel is actually inflammatory irritation. Applying the correct, evidence-based oil acts as a vital mortar. It fills the gaps in that silk mesh, actively locking in moisture rather than punching holes in your baby's natural armor. For the actual massage, apply the piano keys rule. Use no more pressure than you would to gently press the keys of a piano or rub your own closed eyelid. Rigorous dough kneading or pulling on limbs to shape bones causes hidden joint dislocations and microtraumas. This diagram outlines the I love you stroke, a safe technique to relieve infant colic and gas. Gently trace an upside-down U on the baby's abdomen. Stroke up the right side of the belly, horizontally across the ribs, and down the left side. Never push deeply into the organs. Now a severe clinical warning. Never drop warm oil directly into the baby's ears, nose, or navel during this process. Pouring oil into the ear canal traps dirt and moisture, risking severe fungal infections and permanent eardrum damage. Inhaling oil droplets through the nose can cause a highly lethal condition called lipid pneumonia. The ears and nose possess a natural microscopic conveyor belt system for self-cleaning. Just wipe the outside with a damp, warm cloth. Gentle, targeted touch effectively lowers the baby's stress hormone, cortisol, and stimulates the vagus nerve to aid digestion. It is clinically superior to forceful, aggressive shaping. Step 3 is the water check. As you can see in this demonstration, the bath water must be exactly body temperature, between 37 and 38 degrees Celsius. You can measure this accurately with a floating bath thermometer or by dipping your bare inner wrist deep into the water. Do not test the water with your tough, calloused hands. A baby's thinner skin burns at temperatures that adults find perfectly comfortable. Step 4 is the wash itself. This high-contrast timer illustrates our metric. The entire wet process must take less than 5 minutes. Prolonged soaking breaks down the skin rapidly, a condition known as maceration. You only need to target the diaper area, the armpits, and the neck folds. Use exclusively a mild, pH-balanced liquid baby cleanser. Remember the delicate silk mesh anatomy we covered earlier. Using abrasive gram flour, herbal powders, or raw milk acts exactly like sandpaper, violently destroying the baby's acid mantle. Bath time in the 4th trimester serves solely for highly efficient hygiene. We entirely avoid the dangers of a prolonged soak. The final step happens the moment the bath ends. Transfer the wet baby directly into the thick, dry hooded towel you laid out earlier. Gently pat the skin dry. Never rub it. You want to completely preserve the fragile acid mantle you just worked to protect. Immediate dressing is critical here. The transition out of the water is exactly where rapid hypothermia strikes, so you must stabilize their core body temperature without delay. By mastering this precise sequence, you guarantee a clean, warm baby with their internal hydration fully locked in and their natural defenses intact. Even with perfect technique, you need to monitor the baby's response. If you observe any objective warning signs, cease the bathing routine and contact your pediatrician immediately. Watch for bright red contact dermatitis, exactly where an oil was applied. Look out for slightly blue lips or mottled skin. That indicates rapid hypothermia. And listen for a high-pitched pain scream when a specific joint is gently moved, pointing to an underlying injury. We know the cultural friction here is intense. You will likely face pressure from specialized traditional massage ladies or older relatives insisting on outdated, aggressive scrubbing and molding techniques. The responsibility for your child's health rests with you. Your baby is not a piece of clay that needs forceful shaping. They are a perfectly formed, highly sensitive human being. Standing your ground with evidence-based science is the most loving choice you can make for them.